how's it going? Will Albanese here, CEO and pharmacist at Aspira Health with my friend, colleague, and marketing director, Mr. Chris David.
Hi.
Did I elevate your status? I don't know what your status was last time.
I like that status.
Marketing director.
We'll just keep bumping it up. VP of Marketing Operations.
Absolutely.
Managing Partner.
Fixer. We are smiling because we're here. Our flavor today is pomegranate Red Bull. Yeah, there you go.
Brought to you by Red Bull. I didn't know we were going to do this after the blood pressure one. I guess I'm just going to keep it going.
Yeah, no, hashtag not a sponsor. Yeah, keeping it going. But no, we were talking today. We were talking a little bit about travel, about requirements for travel, about vaccines, about testing. You were kind of talking about this a little bit, and Lou, some friends you know that are going to Belize, and you were asking me questions. So we thought we'd tackle that kind of an issue today and give the people out there some information.
Yeah.
Basically about travel and what you can expect. So Aspira offers travel testing. We do COVID testing that is either antigen testing, and we do PCR testing, both of which are rapid. So people ask me, is it rapid? When does it come back? All of them just go to a lab in our back closet, our back lab. They process them, they get you answers in about an hour, we say. So
Can I interject real quick? Because a little bird told me that in order to come and get your rapid test, previously you had to wait around for the results. Now, if you don't have any symptoms, you are able to get the test and then leave, and then you'll update the portal?
Absolutely.
How convenient.
Yep. How convenient. How convenient. So is that plug.
Hashtag how convenient.
Yeah, but that is 100% correct. So you don't have to sit around. You can sit around and wait. Some people just want the piece of paper in hand, or they don't have a printer, or they don't have a computer, or whatever the need may be. Or you're leaving for the airport right now, so you need that sheet of paper. But if you don't want to do that, you can pull it up on your patient portal, and you can just get the results right there, and you can get them wherever you need them.
Will the airlines take the patient portal as proof of vaccination?
Good question.
Sorry, proof of testing.
Proof of testing. So the problem right now that we're having in the United States, and this is November 3rd, 2021, is that there's a piecemeal patchwork and no consistent guidelines across all platforms. You've got layers where you have state requirements, country requirements if you're going to another country, and then also transportation requirements via airline. Public transportation is different in all facets, so there could be different requirements at each level. So you have to kind of take that into consideration. Most times airlines give you guidance and they tell you what kind of testing you need.
On the website, right?
On their website, or they'll email you ahead of time. You should also check if you're going to another country, your friend's going to Belize. Yeah, you might want to check with the State Department and look into the travel requirements, or Belize, check their tourist website and see if there's any requirements on the tourist website.
Right.
That'll give you some clear guidance on what you need. Most of the time, the feedback we get is that as long as you have some sheet of paper, within most of the time it's 72 hours for testing, you're generally pretty good.
Now, if you're not a U.S. citizen, correct me if I'm wrong, and you're not vaccinated, you will not get into the country. But if you are a U.S. citizen, you just need the proof of testing 72 hours ahead of time. Is it 48 or 72, would you say?
So that good question, it depends. Like some places will say 48.
It's complicated, Will.
My brother tried to go to Nicaragua and he missed the deadline by like 2 hours because it was 48, not 72. He was mad.
Just make it 24. Keep it safe.
Make it 2 hours. You get your sheet of paper here and you have to fly to the airport. Helicopter only. Helipad in the next Aspira will just get you to the airport right after you get your COVID testing.
Well, I mean, it sounds complicated, but in reality, you just need to get that test 24 hours, let's call it, before you get on the airline. If you're a U.S. citizen, you don't have to be vaccinated. If you're not, you do in order to get into the country, which probably most people watching this is going to be U.S. citizens potentially,
I hear we're big in Scandinavia.
Yeah, okay.
Yeah, so
all right.
if you're Swedish or anything, like, you might want to, check it out. But no, one surefire way that you can protect yourself is still by vaccinating yourself. So I'm always going to advocate that you can vaccinate. Advocate for vaccinate.
Yeah.
That's important. Get your vaccine card. It's almost like it's kind of like a get out of jail free card in a lot of cases. You can even use it as an argument. I've seen people say, well, because we were vaccinated, they allowed it and we went ahead or whatever. It was, within normal guidelines. we've gotten feedback that the guidelines are pretty loose when you get to the airport. Most people are like, they didn't even ask for the information, or you upload it ahead of time. There's no real vetting. So, not saying you should do that. I think you should take all precautions necessary, especially if you're spending a lot of money on a trip. I mean, Belize ain't cheap.
Yeah,
Probably a couple $1,000s for the flights.
probably.
So you don't want to risk it. We have some of the cheapest testing around. Our antigen testing is $60, which is the 15-minute test. It's not as accurate, but it is, it's sufficient in some cases. PCR testing is $110. Most airport kiosks that have testing available are between $250 and $300.
Yep.
Alternate testing around here is about $200. I know GoHealth, a big big company that partnered with Christiana, their COVID tests are $200 flat, so we're almost we're 50% of the cost. So we're just trying to make it so people can get where they need to go.
Nice. Well, are those covered by insurance?
Some insurance carriers will pay for them, and it's ever changing. I will say right now, Medicare and Medicaid will pay for testing for travel. All other insurance companies will not, and you do have to pay out of pocket.
Okay. Well, that's great information, Dr. Will.
You can call me Will, Chris.
Okay, thanks.
Yeah, so I know you had brought up the CDC website. I think that's where you were looking, right? And you had some travel questions, I think.
Yeah, there's some FAQs on here, which I thought were highly pertinent. So, number one, can people who have recently recovered from COVID-19 travel?
Yes.
Define recently recovered.
Yeah, so the thing they're alluding to here is that after you get COVID, you generally have antibodies and you're considered fairly safe for about 90 days.
Okay.
That's how long we know approximately the antibodies are protecting you. Once again, still the best way to protect yourself, vaccination. That's a separate argument, but we'll go there later. But within 90 days, some places will allow you to travel if you got COVID within the last 90 days because they know you have antibodies in your system. That being said, I still wouldn't leave it up to chance if it was me because you could run into, as I said, there's layered approaches. Who's to say once you get to Belize, if the public transportation may not accept a current diagnosis of COVID, and you need a negative test, the negative test is considered kind of a gold standard right now. So I'd still advocate for getting yourself tested. If anyone requires it anywhere, you have the card available that shows what you're doing.
So, recently recovered, considering that you can test negative, that would be considered recovered.
That would be considered, yeah. And the caveat and the problem is that sometimes after you get a COVID infection, some people are still positive on test 4, 5, 6 weeks out.
Yikes.
Yeah, so if you have the COVID, you get the vid, you go ahead, get your documentation that says you had it and when you had it and when you're out of quarantine. That's the biggest one. You have to be out of quarantine 10 days and then 24 hours symptom-free. And then after you have that, I would also get tested as well, if you're able to.
Interesting topic about quarantine. My friends who are coming back from Belize, do they have to quarantine once they arrive in the United States?
No it's kind of like a spaceman. They're like an astronaut, right? Yeah. Remember they had to quarantine? I think they still do. I don't know. That's a good question.
Yeah, just in case they get some wacky virus on Mars.
On Mars.
Once they come back from Mars.
We can't find any life in the universe, but they have to quarantine on Mars.
Some high standards there.
Right. So yeah, you come back and you don't have any standards when it comes to quarantining. However, I will say if you wanted to get tested, our providers have listened to patient stories where they say, well, we were on a plane, some people were refusing to wearing masks or they were taking them off. If you feel like you've been exposed and you're telling us that you think you may have been exposed, most of our providers will say, okay, we'll test you, we'll bill insurance as an exposure. That requirement for exposure, though, is going to be still the CDC guidelines. We're still following that, and that's kind of within 6 feet of somebody for 15 minutes or more, or you're doing some close activity where you're sharing utensils, cups, kissing and hugging. I'm a very touchy-feely.
Yeah.
Yeah, that happens a lot for me. Don't go to Brazil.
Back it up.
Maximum
We're going to need to talk
exposure.
to HR. Yeah.
Come here, bud. Give me a hug.
Who's covering HR nowadays? Shout out to HR.
Shout out to HR.
You're working overtime.
That's right. Keep them busy.
Question number 2, how can I protect myself from COVID-19 when using different types of transportation? So it seems like a pretty softball hit
Vaccinate,
right there.
wear a mask.
Easy enough.
Get out there, people. Protect yourselves.
You can do that. All right. Next question. How does CDC determine the COVID-19 travel health notice level of a destination? Travel health notice level of a destination.
So a lot of times you're going to have to look, once again, tiered levels. You're going to have to look through, if I understand your question right, I think you want to look at the State Department, look at the State Department's recommendations for that site where you're traveling, and then also any notices that come from that country directly. Because they may be different. I mean, you're talking about different organizations. The State Department does work as a diplomat with that country, but the country ultimately has the last say.
And things are changing
Constantly.
constantly.
Constant change. What is that Volcom saying, I think? Yeah.
No idea.
Skater life. Rock on, dude.
Not a sponsor.
All
right.
Not a sponsor. Willing to sponsor. Yeah. No. So yeah, just you want to check the websites. You want to go around and make sure you have it. Ultimately, if you're vaccinated and you've got a negative test within the last 72 hours, you're pretty much covering all your bases. There's
Great.
nothing you haven't done unless someone has more stringent requirements.
All right. Well, thank you for answering.